So today we're going to talk about parasomnias. And what this is sort of like a broad range of different sleep disorders. Things like sleepwalking, sleep talking, REM behavior disorder, nightmares, night terrors, and things like this. So depending on what your patient is suffering from, we can give them some different advice. If they're suffering from things like sleep talking or sleepwalking, this is something that seems harmless to begin with, but there could be underlying issues or consequences. If we think about sleepwalking, we could, just imagine that if you're asleep and then you get up in the middle of the night and you're still asleep, you're not aware of any of your surroundings. You could walk into a table and get hurt. You could go outside and wander off and someone not know where you are. There are also things like sleep eating disorders, and this can be hazardous because when someone suffers from this, they wake up during the middle of the night and they're essentially sleepwalking, but with an extra step, and it goes as far as to eating. And the most common, consequences that we see from someone suffering from a sleep eating disorder is when they are, going through an episode, they don't know what they're eating, so they could be, eating raw eggs or raw meat. It's even been, documented that people have ingested chemicals and cleaners while they were asleep. So it's very important to sort of, restrict these chemicals, put them in a safe place that might be locked. You could even consider doing things like locking your fridge. And that's just in order to keep the patient safe from themselves and when they're doing something that they're not aware of. For people suffering with nightmares and night terrors, this is something that could be treated with therapy to understand what it is that has triggered this in our patient. Um, it could be from some sort of PTSD or some sort of traumatic stress that they went through in their lives. And it's something that we might not necessarily be able to treat with just a pill. It would be something that they needed to talk to someone about and work through. And this is also true with, REM behavior disorders. Though some like muscle relaxers can be described. What a REM behavior disorder is basically when normally when you go to sleep and you achieve REM sleep, the muscles in your body are paralyzed, so you don't move. If you did, you would act out your dreams. So if you were a Golden Glove boxer in your dream, watch out whoever's sleeping with you, right? So this is essentially what happens with people suffering from a REM behavior disorder. They act out their dreams, and this could be dangerous for, as I mentioned, your sleeping partner. There have been cases where, people were hit by their partner while they were asleep and ultimately injured. And one of the things that I take away from this is the most the most common example I've heard is someone like a war vet. If they go to war and then when they come home and they're trying to sleep and have a normal life, this PTSD sort of forms through their sleep, and they can do things like sleepwalking, sleep talking, or acting out their dreams. We do want to tell our patients that there are some medications and treatments for the disorders that they may have, but we would encourage, just very good health, sleep hygiene, as well as doing things like I mentioned, locking fridges, and different steps that we could take to just make the environment safer. If people thrash a lot throughout their sleep, we could just add extra pillows, maybe pad the bed, the headboards and things